let's break some of the myths about psychiatric medications today.
Yeah.
Okay, so the very common belief that people have about psychiatric medication is that once you start taking the medication, it continues for a lifetime and there's no stop or there's no pause in between for that. How true is that?
That's not actually true. So most diagnoses like depression and anxiety and common mental illness do not require lifelong medications. Very few illnesses like schizophrenia or bipolar disorder will require long-term medications. Yeah.
So that requires medication for a lifetime, schizophrenia and...
For some patients, yes.
Okay, right. Are psychiatric medications addictive in nature, sir? That is one of the reasons why people fear taking medications, coming to a psychiatrist.
So the fear of getting addicted to medication comes only when it is psychiatric medication. Nobody thinks about getting addicted to insulin or BP medications or thyroid medications.
Yes.
So we just have to think of mental illness in a way that it can be managed by medication and it needs to be taken when it's necessary and we can stop when it is necessary. Psychiatric medications are not addictive. Actually, many psychiatric medications do not have the properties of any withdrawal or tolerance or craving. Some medications like benzodiazepine can have addiction potential, but if it is monitored regularly by a psychiatrist, I don't think it has any reasons to be addictive.
Some patients or some people usually stop taking medications once they start feeling better or if they feel they're good to go without even informing the doctor or someone whom they are consulting. So is it good for them, sir?
What is actually recommended is once you become better, you maintain in the same dose for a few months and then according to protocols, diagnosis, individual needs, we taper and stop the medication and then monitor the patient. It's not actually recommended to stop once immediately you become better. You run a risk of discontinuation syndromes.
Okay. The next myth is psychiatric drugs or medication have dangerous side effects. What do you have to say about that, sir?
I think that's also one of the common myths that we face in practice every day. Most side effects are manageable, dose dependent and are very transient. Once you start a medication, maybe you can feel a bit of side effects for a couple of weeks, but then it will plateau and it will settle down. So I don't think we need to worry about side effects of medication, especially when the benefits outweigh the risk so much.
Have you heard this sentence, medication is a sign of weakness?
Yes, every single day. Actually, it's quite the opposite. So taking medication means that you're self-aware and it's a strength that you have taken the next step on your mental well-being.